Talk about the steroid thing now. Baseball's steroid scandal, and they might be calling it a baseboid here. No.
I don't think so.
Is being talked about all over the country this morning. Everybody's buzzing about
this. Yes, because of what happened yesterday. Former U.S. Senator George Mitchell released a 400-page report outlining rampant steroid use in Major League Baseball. 80 people were named in that report.
Did that surprise you? 80 people, baseball players, including Barry Bonds. We all know about Barry Bonds. Pitching legend Roger Clemens, that was a shocker. The evidence was mostly provided by former trainers.
People in the clubhouses dealing with the players.
Clubhouse attendants in New York, I think. The report says it used eyewitness testimony, money orders, and checks signed by the players, as well as mailing receipts for the steroid shipments.
It's estimated that as many as 6% of high school athletes use steroids. So if you're a parent, you're going to want to listen, because this would obviously concern you.
With us live this morning, Dr. Dave Carfagno of Scottsdale Sports Medicine. Good morning, doctor. Thanks for coming on with us.
Good morning, Rick. Thank you.
Pretty interesting. There's a story in the Wall Street Journal this morning that says the average steroid user is not in professional sports. A lot of 30-year-old men, for example, that want to look good use it. To make better their appearance, work out, do weights and strength training. What is the downside of using steroids?
Well, most steroids, if you remember, testosterone is produced by the body, and so in high level dosages, it's considered anabolic, and it's a growth potentiating. It's also in a class of narcotics, scheduled narcotics like Oxycontin, Vicodin, so it has a very high addictive potential. So the one thing is it's a drug that has a high addictive. But long-term side effects, cardiovascular-wise, heart attack, stroke, cholesterol abnormalities, liver problems, from the long-term standpoint, gender-specific problems in men, such as fertility issues, testicular atrophy, and even fatty tissue in the breast, women, menstrual irregularities, and voice changes. And not to mention, we've seen in the news in the last couple of years some of the psychiatric issues in some of the other sports, such as roid rage and personality, and then long-term depression.
Now, Dave, are these side effects that you're talking about, are they the same for teenagers if teens are using them, or is it worse?
Teenagers can be worse because that's their developmental years when testosterone is being produced on a high level in pubescent years. But the problem with using it at its teenager level is that your bones are growing, so it could stunt your growth. You can have psychiatric disturbances, and again, it can affect your hormones later in life.
One of the prominent Arizona Diamondbacks connected with this was Matt Williams, who I think admitted to using a growth hormone, human growth hormone. Is that the same thing, and what's the downside there?
Human growth hormone is produced in a different area of the body called the pituitary gland, and it is a hormone, and it's made up of many proteins, but no, it does have similar effects as far as increasing muscle mass and decreasing your body fat, but there isn't the addictive potential yet. But it does have a blood test that's being produced by the Major League Baseball, which should be down the pike. It's being looked at right now on the International Olympic Committee.
So, doctor, what would you recommend for parents and teenagers and just athletes or anybody who's looking to build muscle? What's the best way to do that? Is it just simply going to the gym?
Well, it gets back to the old adage of diet and exercise, multiple small meals throughout the day, increasing your protein. What we try to stress with, if you're going to increase muscle, is about 1 gram per pound of protein per body weight, and divide that up throughout the day, and make sure that you're seeing somebody who can design an excellent exercise program that's going to be developing for strength training, and something that's going to have a high load that's specific to your sport.
Okay. We're going to wrap it up. Doctor, where do you practice?
I'm in Scottsdale. Scottsdale Sports Medicine.
Scottsdale Sports Medicine. Dr. Dave Carfagno. Thank you very much.
Thank you.
Merry Christmas. As you could tell, I have been working out.